Time now 5:12 this morning. The results are in, and the LGBTQ plus community is speaking out.
Members just participated in a large-scale study to address their concerns and growing needs here in Northeast Ohio. This comprehensive outlook is new and historic for Ohio.
Our Mike Holden diving deeper into the data. And Mike, it covers a wide range of issues.
Guys, good morning to you, and it really does. It's important to mention, though, this was all led by Kent State University's College of Public Health. They surveyed LGBTQIA plus community members for 2 years. Researchers say this study addresses the physical, mental, and emotional needs of a group experiencing immense stress and ongoing challenges head on.
I think it speaks to the fact that we still aren't feeling recognized, accepted, included in society.
That is just one of the many key findings of the Greater Cleveland LGBTQ plus Community Needs Assessment. More than 2,000 people shared the most pressing issues and concerns occurring in the region. Kent State's College of Public Health worked with 120 organizations and nonprofits to uncover the findings.
There was one question that I look at as the most important. And we asked people, what is your biggest fear, worry, or concern for yourself as a member of this community?
Andrew Snyder and his team received more than 850 open-ended responses, combing through each for weeks.
It was to foster a culture of inclusiveness, open-mindedness, empathy, acceptance, and respect, not just outside the LGBTQ community, but also internally as a community within ourselves.
The sampling is strong. 85% of the members from Cuyahoga, Geauga, Lorain, and Lake counties took the 130-question survey and finished it. Some of the key findings include 55% expressing concerns about the safety or acceptance in certain parts of Cuyahoga, Lake, Lorain, or Geauga counties because of their LGBTQ plus identity. 32% reported feeling discriminated against at work due to their sexual orientation or gender identity. Nearly a quarter experienced housing insecurity, and 30% reported past experiences of food insecurity. 5% did not have health insurance coverage, showing a gap in access to essential health care. And 93% said they had to seek out LGBTQ plus sex education or information on their own.
We found that many felt a sense of uncertainty, feeling a sense of hopelessness, and unsure of what to do.
Jelani White, who worked on this study, says the research was stunning, but it also highlights the opportunities for change and room for growth. Priorities moving forward, they say, will include increasing inclusiveness, acceptance, visibility, and offering up better legal protections in and out of the workplace.
How can we give them that assurance? How can we give them the tools to be able to share their voice, reach out to senators and advocate?
Now, this survey actually includes more than 360 unique data points that they plan to dig through for further research and then take into daily action. The overall goal is to increase protections across the board. And in addition, more surveys are planned in the near future, including expanding to areas as well as Youngstown and neighboring counties. For the full list and the breakdown, click this story, news5cleveland.com, and our app. Mike.
All right, so before we let you go, we got a couple of questions here. So what compelled them to do this survey? What was the catalyst?
Yeah.
How long did it take to compile the questions and then actually find the people to answer them?
That's what I was curious about because of all those data points. So they said it took several years, starting back all the way in 2020 with really the pre-planning process and questions. And Andrew said it's so important because there's no true scale of the LGBTQIA plus population here in the U.S. because they're not identified in the census. But this, he says, provides context and data, and those are the first steps toward change.
It's important that everybody has their voice heard. Mike, thanks for bringing that to us this morning. Appreciate it.